Welcome back, everybody, to the deep dive. This time, we're going deep into the world of endodontics.
Ooh, endodontics.
That's right, we're talking about saving teeth.
Mm.
Most people think root canals when they hear endodontics,
Yeah.
but it's a whole lot more than that.
It really is. It's about why do we try so hard to save our natural teeth?
Exactly.
Huh?
Because I think we just assume if a tooth is giving us trouble, just yank it out.
Right.
Problem solved. Easy peasy.
Yeah.
Why not just extract it and replace it? What's the rationale behind going through all that effort to save a tooth?
That's what we're diving deep into today. At first, it might seem a little extreme,
Yeah.
but there are some really compelling reasons why it's usually best to try and keep your natural teeth.
Well, I'm definitely intrigued. What is it about our teeth that makes them so worth saving?
Well, think about it. Our teeth are more than just tools for chewing. They have a huge impact on how we speak. They contribute to the structure of our faces.
Yeah.
And of course, a healthy smile
Yeah.
that does a lot for self-esteem.
I never really thought of it that way, but it makes total sense. So losing a tooth affects way more than just being able to chew your food.
Exactly. And a tooth's anatomy is actually much more complex than people realize. Each tooth has this pulp chamber and root canals inside. It's like the living core of the tooth.
So there's like a whole world going on inside our teeth. It's like a tiny little city in there. What happens when things start going wrong in that city?
That's where endodontics steps in. Sometimes that inner pulp gets damaged, maybe from really bad decay, trauma to the tooth, or even from having a lot of dental procedures done on it. And when that happens, it can set off this chain reaction.
Oh, like one problem leads to another and another, and suddenly you're in a full-blown dental disaster. I actually knew someone who chipped a tooth in a biking accident, and he said the pain was just unreal.
That happens a lot, unfortunately. Damage to the pulp can cause inflammation, which can lead to infection.
Uh-oh.
And sometimes that infection can even spread into the bone around the tooth.
That sounds pretty serious. What can endodontics do to, like, stop that domino effect from happening?
You can think of endodontic treatment, like a root canal, as a rescue mission. It's about getting in there before those small problems turn into something much, much bigger.
So instead of just yanking the tooth out, endodontics tries to actually treat the root of the problem.
Exactly. And it's much more intricate than most people realize. Endodontists use these teeny tiny instruments to reach that infected pulp. They clean and shape the root canals with unbelievable precision.
Wow.
Then they disinfect the whole area thoroughly, and finally, they seal the canal so that it can't get reinfected.
It's like microscopic surgery. But let's zoom out a bit.
Yeah.
We've talked about why saving a natural tooth is so important.
Yeah.
But could you break that down a little more? What are the benefits beyond just getting rid of the pain?
Well, keeping your natural teeth helps keep your whole mouth in balance. When you lose a tooth, it creates this gap that can cause your other teeth to shift and wear down unevenly. And over time, that can lead to problems with your jaw.
So saving a tooth isn't just about that one tooth. It's about protecting the health of your whole mouth.
Exactly. It's like a puzzle. All the pieces have to be in the right place for it to work right.
I'm starting to see why endodontics focuses so much on preserving teeth. But I bet some people listening are still thinking, isn't it easier to just pull the tooth and be done with it?
That's a very common thought, and I get it. But honestly, while taking the tooth out might seem simpler in the moment,
Okay.
it can lead to needing even more complicated and expensive procedures down the road, like bridges or implants.
So it's sort of a trade-off between short-term ease and long-term health.
Exactly. The goal is a lifetime of healthy smiles. And for most people, saving their natural tooth is the best way to achieve that.
Okay, I'm definitely getting a clearer picture of why endodontics takes this approach. But I'm guessing there are still some common concerns and maybe even misconceptions about it, right?
Yeah.
Especially when it comes to root canals. And it's important to address those because, as you said, we want to help people save their teeth, not make them afraid to go to the dentist.
Definitely.
So let's bust some myths. What are some of the most common worries you hear? And how does the reality of endodontics stack up?
Well, I think the biggest one is that root canals are just excruciatingly painful.
Yeah, everybody's heard the horror stories.
Exactly. But the thing is, modern endodontics, it's really come a long way. With the technology and anesthetics we have now, root canal treatment is, virtually painless.
Really? So those horror stories are mostly just outdated.
Pretty much. In fact, a root canal is often more comfortable than pulling the tooth out.
Well, that's good to know. I think another worry people have is how long a root canal will last. Like, is it a temporary fix, Or can it actually last for a good amount of time?
If you take care of it properly, a tooth that's had a root canal can actually last you a lifetime.
Wow, a lifetime. I had no idea. It really shows how valuable it is to try and keep your natural tooth structure whenever possible.
Absolutely. And it's funny because a lot of the fear around endodontics comes from people not really understanding what's going on inside their teeth.
Yeah, that makes sense. We talked about it a little earlier, but can we dive a bit deeper into the anatomy of a tooth? Maybe that would help clear things up.
For sure. Picture a tooth like a castle.
Oh, okay, I like this.
It's got these strong outer walls made of enamel and dentin protecting the inside.
So what's going on inside the castle?
Right in the heart of the castle, you've got the pulp chamber. That's where all the tooth's nerves and blood vessels live, keeping it alive and healthy. And running from the pulp chamber down into the roots, you have the root canals.
So the pulp chamber is like the central command center, and the root canals are the passageways connecting everything.
You got it. And when we talk about pulp damage, we mean damage to that command center and those important passageways.
So if bacteria get in there, it's like they're laying siege to the castle.
That's a great way to put it. And if you don't do anything about it, that bacteria invasion can weaken the whole structure, and eventually you could lose the tooth.
So endodontic treatment is like sending in reinforcements to fight off the invaders and strengthen the castle walls.
Exactly. Endodontists are highly skilled at working within those tiny passageways, getting rid of the infection, and basically restoring the tooth's defenses.
That analogy really helps me visualize what's happening on such a small scale. It also emphasizes why it's so important to take care of those castle walls in the first place.
Definitely. And it shows how endodontics is about so much more than just treating pain. It's about being proactive and maintaining the health of your whole mouth for the long haul.
That makes a lot of sense. Switching gears for a second, I know cost can be a big concern for people when it comes to dental work. Is endodontic treatment a lot more expensive than other options, like just having the tooth pulled?
It's a very common worry, but you have to remember that ignoring a dental problem often leads to more serious and more expensive treatments later on. So, in many cases, endodontic treatment is actually an investment in your long-term oral health.
So you're saying it's better to deal with it head on instead of putting it off and
Right.
potentially having to deal with bigger problems down the line.
Exactly. Early intervention is key. And actually, while we've been focusing on root canals, there are other endodontic treatments out there too.
Oh, really? What are some of those?
Well, it really depends on each situation,
Okay.
but sometimes a pulpotomy might be recommended. That's where they only remove part of the pulp, and it's often done on baby teeth to allow the root to keep developing.
So there are different approaches depending on how bad the damage is and what kind of tooth is involved.
Exactly. Another option is apexification. That one's used to help the root grow in immature teeth that have had pulp damage.
It's amazing how many different techniques there are to save teeth these days. It sounds like endodontists have a whole arsenal at their disposal.
They do. And they're experts at figuring out the best course of action for each individual patient.
Okay, I'm feeling a lot more confident about the possibilities of endodontics. But before we wrap up, there's one last question that I bet is on a lot of people's minds.
Go for it.
We talked about how bacteria play a big role in pulp damage. What are some practical things people can do to prevent those bacteria from causing problems in their mouths?
That's a great curl, and it really comes down to good oral hygiene.
So the basics are still the best defense.
Absolutely. Brushing twice a day, flossing every day, using an antimicrobial mouthwash, all of that can really cut down on the bacteria in your mouth.
And I'm guessing regular dental checkups are key too, right?
For sure. Your dentist can catch those early signs of decay or infection before they become a bigger issue. It's all about prevention and catching things early.
Well said. I think we've covered a lot of ground today, and I have to say I'm feeling much less apprehensive about endodontics than I was when we started this deep dive.
Me too. It's been great to really demystify this field and explain why it's so important to preserve natural teeth.
It's been incredibly informative, and I hope our listeners are feeling more confident about taking care of their oral health.
Yeah, it's all about understanding the big picture and how taking care of our smiles pays off in the long run.
Exactly. And, I think it's important to remember that there's no shame in needing dental treatment. It's really just like any other part of taking care of your health.
That's a really good point. It's all about self-care and knowing when to ask for help from the experts.
Exactly.
Speaking of which, I think we've given our listeners plenty to chew on today, so to speak.
I hope so. We've really dug into the why behind endodontics, explored tooth anatomy, and busted some myths along the way. But of course, we've only just scratched the surface.
Right. That's what makes it all so interesting. There's always more to learn. We've hopefully sparked some curiosity, and now it's up to our listeners to keep exploring.
Absolutely. And there are so many great resources out there. Books, articles, online forums, videos. The information is everywhere. Don't be afraid to dive deeper, ask questions, and seek out different perspectives. It's all about being an active participant in your own health journey. Who knows, maybe this deep dive has inspired some future dentists or endodontists out there.
That would be fantastic.
No.
But whatever path you're on, I hope this episode has left you feeling more informed and empowered to take care of your smile.
Well said. It's been a real pleasure having you as our expert today. Your insights have been incredibly valuable.
The pleasure was all mine. It's been great chatting with you.
And to all our listeners, thank you so much for joining us on this deep dive into the fascinating world of endodontics. We hope you learned something new and maybe even gained a new appreciation for the amazing science that goes into